what you've all been waiting for, the new normal, reimagining a transplant, post-transplant life. So just to tell you a little bit about myself, prior to coming to the Family House, I focused on supporting people that were attempting to manage complex medical diagnoses. So that looked like providing supportive counseling, providing discharge planning services in regional hospitals, coordinating care, as well as doing individual therapy and facilitating support groups. So here today, you really are in for a treat because these are the kinds of things that I talk about with people all the time. How are they managing their complex medical diagnosis? And it's just not how are you managing the medical component. We're going to talk about 8 domains of transplant living. We're also going to talk about how do you evaluate your current level of functioning, and then we're also going to talk about how you can plan to address the areas that you need more support in. So the next polling question that we have, just want to share results of where everybody is from. We have like almost a tie between people that are living outside of Philadelphia but in Pennsylvania and those that are living outside of our tri-state region. And we have a few people internationally joining us. So thank you so much for being here, everyone. So the next question that I want to ask is, what is your role in the transplant process? We all know that we can't get through the transplant journey without having teamwork. So whether you're a transplant patient, you're a caregiver, you're a member of a medical team, or another affiliation with the transplant process, your part is so important. Everybody plays a valuable role in the transplant process. And it looks like we have mostly patients with us today. We have a handful of caregivers, a few medical team members, and other. So if you responded other, if you could pop in the chat how you consider yourself as part of the transplant process, we would be happy to hear about that. Okay. The next question I have is which part of the transplant life cycle are you in? So what that means is pre-listing. Are you going through the transplant evaluation process? Have you been listed, but you're waiting to receive the call? Do you have someone that's currently hospitalized? Do you have someone that just got their transplant surgery? Do you know of anybody that's transitioning home immediately after transplant surgery? Are you post-transplant? You're going through your post-transplant appointment? Do you know of anybody that's hospitalized, but they have already received their transplant? Is anyone going through grief and loss or the process of death and dying? So why is this so important? We need to know where we are in the life cycle in order to address the different domains. And as you can see, there are aspects of the domains that we will leave. So once you are out of the listing and listed section, you're not going to be there unless you're relisted, right? The moment that you enter into post-transplant status, you're post-transplant, unless you enter in a different phase if you have a hospitalization or you're experiencing another major life event. So we'll share here that most of the folks that are joining us today are post-transplant. They're going through that journey. All right, a few more questions and then we'll get rolling with. So this is more or less a pre-test, so to speak. So out of these domains that we're going to cover in a lot of detail, which of the following do you feel like you need the least amount of support? Meaning, which area do you feel like you have down pat? Like people are coming to you for this information. Are you the finance guru in your community and everybody comes to you? Or are you the person that everybody talks to and you know, like, I can communicate my needs? Is your emotional well-being on point? And you're like, yes, I got everything under control. So this is where we're saying, what do we need the least amount of support in? What do you have completely under control? and you're good to go. So we have some more votes coming through. And you can select multiple domains. So if there's multiple things that you feel like you got under control, please check all of the ones that you feel you have under control. Okay. All right, looks like the majority of people have responded. Let's move on to the next question, which is, which domain do you feel like you need the most support in? So what are these areas where you feel a little bit self-conscious and asking for help? Which areas do you feel like, you know what, I don't even know where to start? Which are the areas where, you know, you recently asked for help and you're on your way to getting more support? So as of right now, we have 93 people that have joined us. Oh, 95. So let's see if we can creep up these numbers. We're about halfway there. People are voting. Okay. All right, just a couple more. Okay. So it looks like, as of right now, before presenting any information, a majority of the folks are looking for more support in the emotional well-being section. So we'll come back to this question at the end of the presentation to see how you're feeling and if that changes. All right. So we've covered the transplant life cycle. One thing to always keep in mind, again, we've covered this, but I want to overemphasize this, that it's not just one person that is the most valuable person, the MVP, so to speak. We're talking about patients, and we're talking about adult patients and pediatric patients. A lot of times people forget that there are children that are experiencing organ transplants. Our caregivers are not only our spouses and our adult children. Sometimes our caregivers are neighbors. Sometimes our caregivers are paid employees of a nursing administration. So we have to consider how we think about patient and caregiver, and then certainly our medical team. We wouldn't be able to get through any of this without the support of our medical team, and the medical team really wouldn't be able to get through this without us. So it's a big community that we're working with. So the first domain is communication. These are 4 things that I find that are the biggest aspects of communication that need to be tended to. So how well do you feel about communicating your needs? How do you feel about communicating how you feel? Are you consistent with that communication? And how well are you at communicating your boundaries? So these are some things that a lot of times people don't know the answers to because they weren't asked. So let's take the opportunity to do that. So this resource I really love a lot. For those of you that have met me at the Family House or in any other social work capacity, you know that I really appreciate the feelings inventory by the Center for Nonviolent Communication. So I want us to take some time to look at this feelings inventory. On the left-hand side, they are pleasant feelings. So feelings when your needs are being satisfied. And on the right-hand side, they're feelings when our needs are not being satisfied. I classify these as unpleasant feelings. Feelings that people really don't want to feel, but they happen. So if you wouldn't mind, pop in the chat some feelings that are resonating with you on this list, whether it's from the left side or the right side. Someone shared a feeling of anxious, blessed, hopeful, worried, grateful, curious, awed, empowered, eager, forgotten, grateful, vulnerable, lonely, scared, disconnected, frustrated, distressed. Yeah, so when we're thinking about these feelings, we have to I believe we have to ask ourselves on a regular basis throughout the day, how am I feeling? If we're not asking ourselves that question, it's going to be very hard to tend to our needs or to expect somebody else to tend to our needs. So if we don't even know how we're feeling, how are we expecting someone else to know how we're feeling? How are we going to expect someone else to know how to meet our needs? So for the caregivers in the room, the responsibility of knowing how we feel is on us. And the responsibility for the patients on how they feel is on them. So we're responsible for checking in with ourselves. And we're also responsible for communicating what we need. There are going to be times where the people that we love the most are not going to be able to meet our needs. Not because they don't want to, but because they're not able to. They're tired, they're exhausted, they're worried, right? All of the feelings that you just shared. So where do you go to get your needs met? We'll address that a little bit later. So thinking about communication within the transplant life cycle. So just focusing in on these different aspects, right? If you're in this moment of, I'm ready to start a new life, who are you communicating that with? Are you communicating to people, you know what, I'm ready to start my new normal. And things are really weird right now, especially with COVID-19, but I'm ready. I'm ready to tackle this. I'm ready to have a new life. Who knows that? Is it only you that knows that? How do you feel about that? For those of us that are pre-transplant, right, have you communicated how you feel about going through the pre-transplant process? Again, for the caregivers in the room, have we discussed with the person that we're caregiving for how you feel? A lot of times we don't share with our nearest and dearest how we feel because we're worried that we're going to worry them. I have to keep on a strong face because if I don't, they're not going to do well. I would challenge you to consider that the more boundaries you are with your feelings and sharing your needs, the less likely that you are communicating what you actually need. So if you're saying to yourself, I'm fine, I'm fine, I'm fine, and then you're telling everyone else, I'm fine, I'm fine, I'm fine, you're creating this boundary of saying, I don't need my needs met. That's not fair. Everybody needs their needs met, and we'll talk a little bit more about that as we go on. So the next thing is medical responsibilities. So there's a lot of things that are on your plate being part of the transplant process and managing all of this. You have appointments, you have lab work, some of us have dietary restrictions where we can't eat certain things, you have activity limitations. How many folks have been told post-transplant that they're not allowed to drive, right? How many folks have been told, well, you're not supposed to lift anything over a certain weight? You shouldn't ambulate stairs at a certain pace like you used to. And then medication management. That's complicated. There are all these conversations that you're having with your medical team and the pharmacist, your caregiver, with the patient about medication management, the pill boxes, right? How big are the pill boxes? How many pills do you have? All of these things factor into that medical responsibility. So thinking about your medical responsibilities, how that shifts between each phase of the transplant life cycle. How do those things shift? When we're worried in this listing moment, how does that impact how compliant we are with our appointments, our medications, our dietary restrictions versus post-transplant? Something to think about. Work responsibility. So this is huge. So once you get a complex medical diagnosis, the first thing, even going to a doctor's appointment, I have to take off work. How long am I going to be out of work? When can I get back to work? It's this work. And for those of us that are in the retired phase of our life, some of us have thought, you know what, I didn't think retirement was going to be like this. Or I was anticipating enjoying my retirement, and now maybe I'm not going to be able to do that because my loved one is going to be going through a transplant. I'm going to have to continue to work. For those of us, there are some people that I've met that they have lost their jobs because they didn't have family medical leave benefits. Some of us are working multiple jobs to keep ourselves afloat and our families afloat. So work is really not something that is just for a certain age group or a certain type of patient or a certain type of caregiver. Everyone's impacted by that. So when you're thinking about your work responsibilities within the transplant life cycle, how are those things changing? Now, as far as the new normal goes, right, establishing this new normal, you're going to be looking at this at every phase. So all the squares that are green in this cycle are going to be addressed in each and every phase of the transplant life cycle. So this idea of having a new normal, it should be talked about during the pre-transplant phase. It should be talked about after every hospitalization, certainly upon receiving your transplant surgery, and then post-transplant. So it's not a one-and-done conversation. You're constantly changing. Things are constantly moving in ebb and flow. So this concept of new normal, your new life, will constantly be something that you have to consider. So don't feel like you missed the boat if you're at a certain phase in your transplant life cycle and you're just like, wow, I should have been doing this the whole time. That's not true. There are things that we're learning new every single day, and that's going to make the impact of, wow, this is a new day. Finances. So a lot of people don't like talking about finances, and I can respect that. But as a social worker, I'm trained to have very difficult conversations. So one of the things that we have to think about, we have to, is how do all these things add up? Medical bills, household bills, shared expenses. What I mean by shared expenses is not necessarily the cut and dry bill that you get in the mail, but let's say, for instance, you are, like myself, for instance, I have a sister, and if we have one of our aunts that's going through the transplant process, and we're helping her through the transplant process, right, there might be a shared expense. So I can't just rely on, what the cable bill is and the internet and my car payment. It's other responsibilities that you share with someone else that are going to impact your overall financial health. So at this moment, do you know how everything adds up? Are you putting your head in the sand and saying, I'm not going to worry about it? I have insurance. I have a good pension plan. Don't worry about it. I would challenge you to consider where you are in your financial health. Now, there's a link here, and you'll have access to these slides through our website and through email, whichever you prefer. But Transplant Living talks about the cost of transplant. So I'm just going to read these off to you so that you can get a sense in the event that you might be thinking like, okay, yeah, I know finances, bills, I understand what that's about. So transplantliving.org is a website that is hosted by UNOS, and I have a link to the UNOS website that'll be really helpful for a lot of us on the call today. And they put together a complete list of all the different costs. And the one thing that I would caution everybody is to make sure that you're getting information from reliable sources. So UNOS is a very reliable source. So the medical cost checklist, I'm just going to run through this. Insurance deductibles, insurance copays, pre-transplant evaluation and testing, fees for surgeons, physicians, radiologists, anesthesiologists, lab tests, fees for the recovery of the organ from the donor, right? Surgery, follow-up care and testing, additional hospital stays for complications, anti-rejection and other medications, which they say estimates up to $2,500 a month. And I've known many people that have their immunosuppressant drug regimen add up to more than that. Rehabilitation for skilled nursing, food, lodging, long-distance phone calls, right? That's kind of a thought of the past in our global world, but still, transportation to and from your transplant center before and after your transplant, plane travel to your transplant. Some people have to be life-flighted over to their transplant center in order to get the care that they need as fast as possible. Child care, lost wages, especially if your employer does not provide paid time off. And if your transplant center is not close to your home, the cost of lodging. So these are all things that we should consider in our financial health. So do you know how it all adds up? It's very overwhelming, but it's not going to be addressed if we put our head in the sand. So again, thinking about how our finances shift, ebb and flow throughout the transplant life cycle. The next thing, leisure. So one of my favorite movies, I love baseball. So one of my favorite movies, the quote is, "There's no crying in baseball." A lot of people think there's no leisure in transplant. I disagree. I completely disagree. There is no particular phase of life that I don't think that we should subject ourselves to not having these moments of joy, these moments of laughter, these moments of just reflection of like, okay, I feel okay today, and I'm going to do something for myself. This is so needed, not only through our patients, but also caregivers. How much fun have you been having since you've been assigned as being a caregiver? I would challenge you to say, if I haven't had that much fun, I'm going to start introducing some fun into my life. And we'll talk about how you can figure out if you're doing well without fun. I would argue that it's going to be very hard to live this new life, this new normal, without invoking some level of leisure and fun. So the day-to-day, you're probably thinking, Aisha, you're talking about fun. I'm thinking about day-to-day, the hustle and bustle. You know, it's one of those things where I don't have time to think about that. There's no time for fun. I understand that. We have a lot of things in our day-to-day. We have to cook, we have to clean, we have to do laundry, we have to worry about our pets, our children, we have to worry about grocery shopping, yard work, household maintenance. How many of us every single time winter comes around, especially for those of us in the northeast corridor of the United States, you know, it's getting cold, I hope the pipes don't freeze, who's going to fix the furnace, you know, all those things. Who's going to shovel the snow, right? All of these things we don't think about. Who is going to be the person that's going to do that? So depending on where you are in your transplant life cycle, have you had those discussions? If you are the primary caretaker of the household maintenance responsibilities at your home, and you're the transplant patient and you have a hospitalization, have you designated someone to take that over? As the caregiver, if you are the primary person that's bringing in finances, and all of a sudden you have to take unpaid leave off of work, have you talked about who's going to bring in that extra income? How are we going to do that? All of these things are intertwined. And I want to challenge you again to consider, are you having these conversations with one another? So relationships, this is big. So we really can't accomplish much without being in relation to one another. So I think about relationships within the context of the transplant life cycle as you, everyone else, and the transplant life cycle. So it doesn't matter who you is. You could be, you're going to replace that with caregiver. So being a caregiver, everyone else, and the transplant life cycle. How are you negotiating and renegotiating your role? For those of us that are caregivers to a spouse or a partner, there are a lot of things that you have to negotiate in a partnership and a marriage. Some of those things are going to shift as you become a caregiver to that spouse or partner. For those of us that are used to not having anyone do anything for us, and to be told by our medical doctor, you're going to need a life-saving organ transplant, that can be devastating. So how are you going to negotiate asking for help, receiving help? Have you had these conversations? For those of us that are adult children who are caregivers and our parent is the patient, that's really tough, right? We're telling our parents what to do, where to be, how to do it. They're not used to that. We're not used to that. So all of these different things are just so unique to the experience that we're having. So challenge yourself to think about, how am I negotiating and renegotiating roles and responsibilities? Are we having conversations about these things? Are we putting our head in the sand? Are we having conversations about how difficult this is? All right, next step. So again, thinking about how your relationship ebbs and flows throughout the transplant life cycle. Emotional well-being. So a lot of times when people talk about emotional well-being, they automatically say, go to therapy and join a support group. I'm an advocate of therapy, and I'm an advocate of support groups. But that's not the only thing that's going to be able to sustain us when it comes to emotional well-being. I firmly believe that emotional well-being is tied into socializing. So how are you connecting with your community? Are you volunteering? Are you able to give your time freely? A lot of people find joy in volunteering, and the moment they enter into this transplant life cycle, an aspect of that is completely removed. At the Family House, we have a very strong volunteer network, and a lot of them are really struggling because they're not able to volunteer, do the things that they love. So we're having to help them negotiate what that's like. Resilience is how quickly you bounce back from a setback or a bump in the road. One thing to consider, how well you're doing, is how you are able to bounce back. Now, for some of us, we've experienced these moments where, we just felt really knocked down. My doctor told me I need a lung transplant, and I am beside myself. I hear stories all the time, I wasn't even a smoker. What do you mean I need a lung transplant? It's all of these things that are coming into our mind, and we're thinking, what did I do wrong? I want to speak to that specifically to anyone that's felt like, why is this happening to me? I think it's so important to go back to the components of communication that we pointed out. Find out how you're feeling. Then determine what your needs are. What do you need? Do you need more understanding? Do you need more information? Do you need more peace and solitude to wrap your mind around how things are going for you? And then this idea of recovery. So we're constantly in a cycle of recovery, whether it's physical recovery from our medical diagnosis or the transplant surgery, or even, being bedbound for days or weeks at a time. We have to recover. We have to get our strength back. But then there are many of us that are struggling with substance use and addiction. So that we would be neglecting a big part of who we are if we weren't addressing that key component. And then also mental health recovery. There are some of us that have been struggling with our mental health for years. And then the transplant, the notification of needing a transplant is something that just threw us for a loop and sent us down somewhat of a spiral. How do we get back? How do we balance ourselves emotionally and have that positive well-being? One component that I want to add into emotional well-being is motivation. So some of you may have heard of Maslow's hierarchy of needs, and this idea of motivation really speaks when we're talking about the complex situation of transplant or a complex medical diagnosis. So as we're going up this ladder, now by no means do we go in order of this, but once we get our certain needs met and we're going up this pyramid, there's a unique thing that happens. So according to this theory, it says that as our needs are getting unmet, so this decrease in needs, as our needs are getting unmet, our motivation increases. There's this concept within our mind that says, I'm going to fight. I'm going to do the thing that I need to get my needs met. But on the other hand, as our needs are being met, our motivation decreases. I would argue that it's because we're noticing, oh, our needs are being met, so there's no need for me to be in hyperdrive. The unique aspect of this hierarchy of needs is that once we get above the esteem needs and we enter into the self-actualization, this creativeness, as our needs are being met, our motivation actually increases. So there's a shift here. And just thinking about folks that we may have interacted with or corresponded with, how many of us know someone whose motivation is really just down in the dumps? Is it because their needs are being met to their unique level of satisfaction? Maybe. Maybe it's not because they're lazy, right? It could be that their needs are being met to their threshold and they're okay. They don't need anything else. So just some food for thought. And this link here, this is from Simple Psychology. It goes into a lot of detail about Maslow's hierarchy of needs if you're interested in that. So again, emotional well-being throughout the life cycle. How are we doing? So we've covered all of the domains here. Communication and relationships, our medical responsibilities, our work responsibilities, finances, leisure, day-to-day, emotional well-being and motivation. So these are the domains of transplant living. As I said at the beginning, these are also domains of living with a complex medical diagnosis. These are the domains of caregiving for someone who has a complex medical diagnosis. And for our medical professionals in the room, these are the components that we need to tend to for our patients and our caregivers so that we can check in and see how are you doing? How are you managing these different domains of living? So now is the time to ask a question. How do you feel like you're doing? So after seeing all of these things, and again, you'll get copies of these slides, so you'll be able to think a little bit more about it in more detail. How are you doing with this? What does your day-to-day look like when you're talking about transitioning home after a major hospitalization? What does your work responsibilities look like? And you've just been told that you need a transplant. All of these things are so important to tend to, regardless of where you are in your transplant life cycle. And again, just to highlight, these green rectangles here are something that are constantly going on in the midst of you shifting between the different phases of the life cycle. So these are all the resources that I wanted to share with all of you today. Now, there's a lot here, so I'm going to just highlight a few and then we'll open it up for questions. The transplant-specific resources are specific for transplant. So we have our TRIO link here. For some of you who submitted questions ahead of time, you asked about statistics and research. The Scientific Registry for Transplant Recipients is a great place to go for statistics and research. We also have our Caregiver Lifeline program here, where we have an online library of resources, which is where our PowerPoint slides will be and the recording of this presentation next week. Evaluating your domain. So this is huge. How do you know how you're functioning? So there are 3 resources here: caregiver burnout and self-assessment. So the unique thing about this link is that you can either do the paper version or you can do an online version where it'll actually tally up how you're doing based on your responses of a series of questions. This resource from the American Psychological Association is very robust and has a mixture of research and resources and assessment tools. So if you go to this link, just be prepared for a lot of small print because it's a lot, but it's very, very useful. And again, for our professionals in the room, our medical team members, it's so important for us to also tend to our quality of life. So there is a resource that was provided by the Department of Veteran Affairs, and it talks about provider burnout and being a professional and caring for people that are going through a difficult time. How are we coping with this? Because if we are not up on asking ourselves how we're feeling, how our needs are being met, we will not be any good to our patients and our families. Counseling directory, so all of these links are clickable where you can go in if you're interested in seeking therapy, whether it's individual, family, counseling for couples, or group therapy. All of these links are different opportunities for you to find a therapist that meets your needs. The feelings and needs inventory is here under additional resources. And then many of you ask questions about COVID-19 and transplant. These are the two places that you need to go, okay? So when you're asking specific questions about what should I eat, what should I not eat, go to your medical team. Who should I be interacting with and who should I not be interacting with? Go to your medical team. They are the one-stop shop for you because everybody's situation is so unique and different. It's nearly impossible to have a cookie-cutter response to have it apply to everybody. So again, these are two reliable resources to address COVID-19 and transplant, and I hope you find those useful. And then for those of you that don't live within the family house region, you can access healthcare hospitality houses in your area. So this is a directory where if you type in your zip code, you'll be able to find if there's a healthcare hospitality house near you.